All right, welcome to The Explainer. Today we are diving deep into a condition that so many people live with, but it's often really misunderstood. We're talking about heart failure. We're going to break down what it really is, what's happening inside the body, and how doctors are tackling it today. Let's get right into it. Just think about it for a second. Your heart is this incredible engine that runs nonstop every single second of your life. It's the most reliable machine you'll ever own. But what happens when that engine starts to sputter, when it just can't keep up with the demand? That's really the question at the core of heart failure. And spoiler alert, it's not about a sudden dramatic stop. It's about a pump that's under pressure.
So to really get a handle on this, we've got to start with a solid definition. Let's put this incredible pump right under the microscope.
Okay, so what is heart failure, really? The key here is that it's a clinical syndrome. That means it's not a single disease, but a collection of symptoms. And they're all caused by one fundamental problem. The heart just can't supply enough blood to meet the body's demands for oxygen. Either it's not pumping enough blood out, or it's having to work at dangerously high pressures just to get the job done.
And this right here is probably the biggest myth we need to bust. That name, heart failure. It sounds so final, doesn't it? It sounds like the heart has just given up and stopped working. But that's not what's happening at all. The pump is still pumping. It's just struggling. It's become inefficient.
So, how exactly is it struggling? Well, you can think of it like a mechanical issue that usually falls into one of two buckets. Is the pump too weak to squeeze properly? Or is it too stiff to fill up in the first place? On one hand, you have systolic failure. This is the weak pump problem. The heart muscle itself has lost its oomph, its ability to contract forcefully and eject blood out to the body. Then, on the other hand, you have diastolic failure. This is the stiff pump problem. Here, the muscle might be strong enough to squeeze, but it's become so thick and rigid that it can't relax and fill up with blood properly between beats. Two different problems, but they both lead to the same outcome. The body isn't getting the blood it needs.
So how do doctors measure this? One of the key numbers they look at is called the ejection fraction. It's basically the percentage of blood that gets pumped out of the heart's main chamber with every single beat. In a healthy heart, you're looking at well over 50%. But with that weak pump failure, what doctors call HFrEF, or heart failure with reduced ejection fraction, that number plummets to below 40%. It's a clear red flag that the squeeze is weak.
And this is what makes things so tricky. With the stiff pump failure, or HFpEF, that's heart failure with preserved ejection fraction, the ejection fraction can look totally normal. It could be 50% or even higher. Why? Because the heart is still squeezing out a good percentage of the blood inside it. The catch is, the chamber was never able to fill up with much blood to begin with because it's so stiff. This makes it a much more subtle and difficult diagnosis. Now here's where the story takes a fascinating turn. Your body is smart. It knows when blood flow is down, and it launches this all-out emergency response. But the problem is, this rescue plan is built for a short-term crisis, like running from a predator. When it's activated 24/7, it actually makes the heart failure worse. So picture this. First, your body sensors detect that blood flow is low, and they hit the panic button. That triggers a flood of stress hormones, like adrenaline, which tell the heart to beat harder and faster. At the same time, the kidneys get a signal to hang on to every last drop of salt and water to increase the amount of fluid in your pipes. The idea is to jack up the blood pressure. But for a heart that's already weak or stiff, this is like flooring the gas pedal in a car that's already overheating. This constant state of emergency just wears the heart down, creating a truly vicious cycle. And all of this internal chaos, well, it doesn't stay hidden for long. It starts to bubble up to the surface as physical signs and symptoms. And what those symptoms are often tells you which side of the heart is having the most trouble. If the left side of the heart is failing, it can't pump the oxygen-rich blood coming from the lungs out to the body. So you get a fluid traffic jam. And where does all that fluid back up? Directly into the lungs. This is why the classic symptoms are all about breathing. Shortness of breath, having trouble breathing when you lie down flat, or even waking up at night gasping for air. It's a direct consequence of that fluid backup. Now, what if the right side of the heart is the problem? Well, its job is to pump blood to the lungs. If it can't do that effectively, the traffic jam happens everywhere else in the body. Fluid backs up in your veins, causing that telltale swelling in the legs, ankles, and even the abdomen. You can get a congested liver and even see the pressure build up in the veins of the neck. It's this widespread fluid retention that leads to that noticeable swelling and weight gain.
Okay, I know this can all sound pretty intimidating, but here is the really hopeful part of the story. Modern medicine has completely revolutionized how we manage heart failure. We now have a proactive plan.
And the entire philosophy has shifted. It's no longer just about managing the symptoms, getting rid of the extra fluid. The real goal now is to go on offense and actively interrupt that harmful emergency response from the body. It's about breaking that vicious cycle to give the heart a chance to rest and maybe even heal.
And we do that with a whole team of medications, each with a very specific job. You've got diuretics, or water pills, which provide immediate relief from things like swelling and shortness of breath. But the real cornerstones are drugs like beta blockers, which literally shield the heart from those damaging stress hormones. Then you have ACE inhibitors, which tell the body to relax the blood vessels and stop holding on to salt and water. And now, we have newer players like SGLT2 inhibitors, which offer incredible protection for both the heart and the kidneys. It's a full-on multi-front attack on that cycle.
And it works. It really, really works. As the source material makes clear, these therapies have been an absolute game changer. They've dramatically improved not just how long people live, but how well they live. The whole key is catching the problem early and getting on the right combination of these life-saving therapies.
So we'll leave you with this final thought. Heart failure isn't a destination. It's not an endpoint. It's a manageable, long-term journey. And it really poses a bigger question for all of us. How can we do a better job of supporting these incredible pumps that keep every single one of us going? Thanks for joining us on The Explainer.